And again, we've talked about the benefits of regular exercise on First at 4. Not only do you look and feel better, but exercise also helps ward off certain diseases, and in some instances, it can help cure others. Dr. Milady Murphy is here from Shelton's Health and Wellness Center to tell us about exercise and osteoarthritis. Thanks for being with us.
My pleasure, Janie. Good to see you. You know, osteoarthritis is a degenerative disease. And according to the American Arthritis Foundation, exercise is one of the best things we can do to slow down that degenerative process. There are many forms of arthritis, but osteoarthritis is the most common, especially for the aging population, and we're lucky enough to be in that category.
What is an osteoarthritis versus just regular arthritis?
Well, it's a degenerative disease of the joint.
Of the joint.
Mostly affects the knees, the hip, the back, and the neck, and sometimes the hands. And so what they recommend are 3 different types of exercises. The first is strengthening the heart and lung, but you want to do that with aerobic activity that does not put impact on the joints. Exercises that's highly recommended by them are like walking, swimming, water aerobics. Those are wonderful cardiovascular exercises. Cycling or riding a stationary bike. Something that involves large muscle groups but doesn't have that impact on the joints, the ligaments, or the tendons.
Which would cause pain and more problems.
Exactly. But now, on the other hand, they also recommend doing strengthening activity. Now, when people think, oh, no, strengthening activity, that's going to be tough on the joints. But it really isn't if you lift light weights and you're doing it with a resistant band. Actually, it strengthens the muscles that reduce the pain in the joints, and it protects the joints. And so they also recommend doing strengthening activity. If you don't know how to go about it, ask your doctor to send you to a physical therapist. And if you don't need a physical therapist, then a personal trainer will be very wise to guide you on strengthening without tearing your body down and causing more pain. And lastly, that's also recommended is range of motion activity, stretching. And they recommend stretching almost on a daily basis. And so it's important that you find those exercises, those activities to incorporate into your lifestyle so you stay mobile, you stay active, you don't get depressed,
right,
and it reduces the amount of symptoms that you have associated with it.
So you've got low impact,
very good
exercise.
Yes.
You've got range of motion. What was the second one that you told us about?
A muscle endurance type of activity, strengthening. That's right.
Okay, low impact, strengthening, and range of motion. Those 3 things can help
very
with
good. Absolutely.
Osteoarthritis.
Yes, and
fantastic.
when in doubt, always talk to your physician before
Sounds
starting an
good.
exercise program.
Okay, well, thank you so much
My
for being
pleasure,
with us
Jenny.
today.
Thank you.
And the Health and Wellness Center is located at Shelton State, and there's the website right there. You can learn more about them at sheltonstate.edu.